Good morning, everyone. Welcome. Thank you so much for spending some of your Friday with us and joining us for a virtual town hall about coping with COVID. I'm Risa Rollins-Easley, Chief of Staff with the St. Louis Regional Health Commission. Formed in 2001, the St. Louis Regional Health Commission, or the RHC as we're known, is a collaborative effort of St. Louis City, St. Louis County, the state of Missouri, health providers, and community members to improve the health of uninsured and underinsured residents in the St. Louis region. As part of our mission to improve the health of our community, we promote health advocacy opportunities such as today's event. This event today is sponsored by the St. Louis Regional Health Commission, along with some of our key partners, including Alive and Well Communities, Behavioral Health Network of Greater St. Louis, Generate Health, Prepare STL, the Regional Response Team, and the St. Louis Integrated Health Network. I have the privilege today of introducing you to Rebecca Bennett and Serena Mohammed, who will share some exciting information and updates on what some of our partners are doing, and then we will jump right into the program. Thank you, Rebecca and Serena, for joining us.
Thank you, Risa. Can you hear me? Okay, wonderful. So we are thrilled and delighted to be in partnership with the Regional Health Commission and to be in partnership with the Regional Response Team. I happen to be one of the leaders of Prepare STL. Prepare STL is a joint initiative or campaign of the City of St. Louis and St. Louis County's public health departments, the Integrated Health Network, the Regional Health Commission, St. Louis Mental Health Board, Alive and Well Communities, and the St. Louis Coalition for Community Health Workers. And so together we serve as the community education and action arm of all of these organizations, focused on stopping the spread of the coronavirus among African Americans specifically, and members of the foreign-born community as well. So we want to stop the spread, and we want to help address and alleviate the harmful effects, social and economic effects on our communities as well. So we've been in existence since March. We've done a number of things, done a lot of work in the space of sharing public information, public health information, and PPE with distribution of hundreds of thousands of masks and other personal protection equipment items. But this year, we are shifting our focus some, not getting away from education and PPE, but we are really leaning into living well in the era of COVID. COVID is here, it's going to be with us for quite some time. So we want to make sure that our communities are able to live well, to not only recover, but to ultimately be in a better position in time. And so part of doing that is a focus with the RRT on three things for us. One is on amplifying the importance of health and well-being for African Americans specifically, right? So we want to focus on physical health, and we want to focus on material well-being, all those things we need to survive. So building our immune systems and housing and food security and employment security, all of those things, basic things that we need to be able to survive and live. But we also want to broaden our focus so that we are addressing issues of community healing and community trauma. So we're going to be launching a campaign in February around not only how our health and well-being matter, but also about how we can heal our trauma together. And then finally, the third piece of what we're going to be doing is really focusing on vaccine education with an emphasis on informed choice. We want people to have the ability to make the best choices for them, given their circumstances, right? Given their health circumstances, given their risk factors, and given, quite honestly, their experiences with the healthcare systems, because all of those things help to shape and inform what decision is best for you and your family. So we are committed to supporting informed choice. We are committed to advancing the well-being of African Americans and foreign-born people of color, and we are committed to healing our trauma collectively. And we're doing so in partnership with the Regional Response Team. And that's my dear friend and colleague, Serena Mohammed. So I'm going to turn it over to her.
Thanks, Rebecca. And I want to acknowledge that Rebecca is the leader of Prepare STL, but she also helped to start the Regional Response Team and is a big part of the reason that I'm here continuing the work that she began with Dr. Jason Purnell. So Rebecca has hit the highlights of what we're trying to do with our vaccine education component. I wanted to spend some time just making a distinction between the approach that the regional response team will take compared to what Rebecca just described as being led by Prepare STL. So both of us have been listening to our partners and community members to understand what people are thinking about the COVID-19 vaccine. And what we've heard loud and clear is that people do not want to be told what to do. People want access to factual information from a neutral source that can support their personal decision about whether or not taking the vaccine is right for them and their families. So we've decided to respect individual agency and have taken the position that we will not endorse the vaccine or encourage people to take it. So our focus in vaccine education is really about establishing ourselves as a trusted and neutral source for information sharing and learning so that people are supported in their right to make the best decision for themselves. And it's important to note that this is a joint campaign because it has to be balanced. It's not adequate to put the burden of such a significant decision on individuals alone. We have to make sure that our institutions are equipped to practice real trauma-informed care that centers the voice of community members, delivers services in a transparent and accountable way, and actively works to dismantle racist policies and practices that do real harm to people, especially Black, Indigenous, and people of color. So while our primary audiences are different, our ability to create a space where institutions, service providers, and community members can access information that's needed to make this decision is important. And we're really focused on increasing the trust and accountability in social services and healthcare, recognizing that the lack of trust does stem from real untreated, unhealed, and unresolved trauma at the hands of these organizations and institutions. So we have to acknowledge that and then do the real work of rebuilding that trust and accountability. So on the regional response team side, when we're talking to our institutional partners and our social service organizations, there are 4 areas that we're really leaning into to make sure that organizations build the capacity that they need in order to become those trusted sources of service as well as information. We're doing that through panels. We hosted one panel earlier this month, and that panel was focused on the topic of just understanding vaccines, specifically understanding the COVID-19 vaccine, and then getting an overview of what the distribution plans would look like for the states of Missouri and Illinois. We plan to do more of those panels in different languages, and we'll also have other topics. The purpose of the panels is to create a space for bi-directional conversation where we can hear from community what their questions and concerns are, and then we can bring in experts and other community members to address those concerns. And we'll be pushing out that content so that folks who are not able to see the whole panel can start to see clips of some of the highlights from the information that was shared. In addition to the panel, we plan to use our Collaborative Action Network, which is a learning space for organizations, to dive into 4 topics. And those 4 topics are designed specifically to help increase public accountability or institutional accountability. The topics that those four categories will focus in on are centering community power and voice. So really figuring out how to achieve authentic community engagement, community-driven program evaluation, power analysis, all of those things that organizations need to become proficient in order to really serve communities as partners. Disaggregating data for accountability. We talk a lot about data collection, and we understand that if we're not able to collect and analyze data, we can't identify areas of opportunity and areas of improvement within our own organizations. Creating trauma-informed systems of care. This is another one that may sound familiar because we talk about trauma-informed systems a lot, but it's really getting to the organizational change management that's needed and the culture shifts that need to happen in order to make that happen within organizations. And then of course, dismantling structural racism. So those are the topics that we'll be diving into. And we encourage and invite folks who are interested in participating in that work so that they can build those transparent and trusting relationships to partner with the regional response team. And I'll put our website in the chat. I think everyone can see the chat to get more information about the vaccine education campaign, as well as how to connect to those learning opportunities. And I will turn it over to Risa. Thank you for having us.
Risa, can I add one thing? I don't want to keep you off point, but I appreciate that Serena went into the detail and used this as an opportunity to generate interest in the work that we are doing. So I also want to do that on our side and say, that part of this initiative, you heard Serena talk about institutional accountability, trust, and transparency. And for those who want to lean into that, we certainly need you to do so. We've got to build the muscle to be able to change our systems from the inside out so that they are ready to receive and respond to community choice. Yes. But part of what we're doing in the community mobilization space is having a Living Well in the Era of COVID Summit that will happen in the beginning of June that will address issues that include vaccine education and personal choice and building immunity and healing the helpers and caregivers and mental health and well-being and responding to trauma, all of those things. So if any of those who are on this call are interested and want to participate or have constituencies that they believe want to participate, we would love to have you connect with us, and we'll put our website in. The other thing that we are doing is we are recruiting 300 community health champions. These are regular folks, everyday folks, just like us, who have relationships to hold conversations in their communities with their loved ones about wellness, what it takes to be well, and about vaccine education, just providing basic information and asking people what matters most to you. So we are recruiting 300 of these champions who we will pay, right? So if you want to be, or if you know someone who might want to be a part of our community health champion program, we will provide training on basic vaccine awareness and education. We will provide training on facilitating conversations. We will provide support that include vaccine education experts, that also include community health workers who can help provide support and information resources around housing and healthcare and financing and food security and all of those things. And we will provide process facilitators to also provide support for those community health champions. So we're setting them up to be able to have community-led conversations about what matters most to us in terms of our health and well-being. And we need help in recruiting these 300 who want to serve. So thank you so much. I'll stick our information in the chat too.
Perfect. Thank you both, Serena and Rebecca. I really appreciate your demonstration of what we are trying to do in this work is building relationship that facilitates trust through bilateral communication across various stakeholders that allows us to lean into radical collaboration, to borrow a term from our friends at 413 Ferguson, for the health and well-being of our community. So thank you again for joining us. And that, I think, is a perfect segue into what we're going to be talking about today. So today we have elected officials who have agreed to spend their day with us, to spend some time with us in building that trust and relationship and having these conversations across various stakeholders on how we address COVID's impact on the behavioral health of our community. We talk about trauma and the impact and significance of trauma and how it's touched each and every one of us in every community with this experience of COVID and beyond. So in this context, we're defining behavioral health as the intersection of mental and emotional health, resilience, and well-being. Now, the term encompasses the prevention and treatment of mental illness and substance use disorders and the support of individuals, families, and communities who experience and or are in recovery from these conditions. Now, the questions for our panelists come from our diverse stakeholders, including patients, providers, community partners, and of course you, the participants. And thank you for having submit your questions in advance. The first hour of the town hall will dedicate to answering questions that we've received prior to the event. And the last half hour will be used to answer questions you submit in the chat. So please, feel welcome to use the Zoom chat feature, which you can find at the bottom of your screen. Hopefully you see it there, to submit any questions to our panelists at any point during the panel. Now, today's panel will be moderated by Dr. Heidi B. Miller, who serves as the medical director for the St. Louis Regional Health Commission and a primary care doctor at a federally qualified health center right here in St. Louis. Dr. Miller is also a fierce advocate working to improve the health and well-being of our state's healthcare safety net. I have the privilege of working with Dr. Miller on a number of occasions and personally attest to the passion and energy she brings to serving our community and serving it well. So I'm so pleased to turn it over to Dr. Heidi Miller to kick us off and to introduce our panelists. Thank Heidi.
Thank you so much. It's really an honor to be a part of this dialogue. Good morning. So it's my privilege to introduce our three esteemed panelists, each a Missouri legislator. We have Representative Mary Elizabeth Coleman, who represents parts of Jefferson and St. Louis counties with District 97. Representative Sarah Unsicker, representing parts of St. Louis County and City with District 91. And Senator Brian Williams, who serves District 14, which includes parts of St. Louis County. We are privileged to have you share your time and expertise, intentions, and compassion with us today. So at this point, I would invite our three panelists to turn your cameras on. And we're going to start with the first question. We will have two different types of questions during our panel. Some will be a speed round and some will be in more depth. We start with a speed round question. COVID has hurt our community physically and mentally. According to a recent article in the Journal of the American Medical Association, serious psychological distress was reported by 13.6% of US adults in April 2020 versus 3.9% in 2018. What policies and legislation are you supporting to advance behavioral health in Missouri? Again, this will be just a quick round, 15 seconds each, and we will start with Representative Unsicker, please.
Good morning. Well, thank you for having me. I'm so happy to be here. Since this is a quick round, I won't introduce myself right now, but I want to say I support behavioral health policies in the budget, and I support implementing Medicaid expansion without restrictions. I also support measures to help get this virus under control so that we can return to normal life as soon as possible and reduce the trauma on our communities.
Thank you so much. And Representative Coleman, can I turn it to you?
Sure. Thanks so much.
Oh, speak up a little bit. The sound is a little bit soft.
I'm going to switch pods. Does that make a difference?
Much better, much better.
Okay, great. I'll just take those off. Anyways, thanks so much for having me. Hello, Representative and Senator. Nice to see you guys. This is a speed round. I guess it's kind of hard to start with a speed round question for politicians. We're not going to be very good at this. I think that one of the things that's important is that we're looking at well-being and public health, not in isolation and related to only one illness. One of the shortcomings, I think, of the American healthcare system is that we tend to think in diagnoses or certain syndromes or symptoms instead of the whole person. And so I'm committed to making sure that as we're addressing the COVID outbreak, we're looking at other incidents of health and how that impacts, and particularly mental health. We're seeing people who have family members with ADLs that can't be met, who are keeping their families close because they're worried they'll never see them again. If they go to a long-term care facility, we're seeing skyrocketing substance abuse and suicide attempts within our kids as the isolation and lockdowns continue. And so as we're addressing COVID-19, I think we have to make sure that we're looking at health in a broader scale and not just isolated by one diagnosis.
Thank you so much. Yeah, moving from a disease-centered state to a patient-centered state is desired. Thank you so much. Senator Williams, your turn.
Yeah, thank you. First, I want to say thank you to the Regional Health Commission, as well as CEO Angela Brown and her team for putting together such a tremendous event. I had an opportunity to hear Serena Muhammad and Rebecca Bennett, who are just two exceptional people in the community, and it's good to know them as well. And then Dr. Miller, thanks for putting this together and moderating. When there's a need for mental health services, there should be funding for mental health services. So I was proud to support $5 million increase in funding for Missouri's Department of Mental Health, specifically responding to the impact of COVID-19 on behavioral health. So I believe that was House Bill 14 during the 2020 special session, which dealt with substance abuse and mental health services. And then, of course, with President Biden in office, I expect there to be a continued focus from the federal government on helping states address this issue. And I'll support those through my efforts as I serve on the Senate Appropriations Committee in the Missouri Senate.
Thank you so much. Okay, we're going to move on to the next question. This will be a bit more in-depth, and each of these questions will have a 1 to 2 minute answer. So, for this first question, for this next question, I'll turn it to you, Senator Williams, again. The question is, What common goals do Missouri legislators share across party lines and districts to promote behavioral health in the state? And what concrete steps can we take or can you take to work towards these goals?
Well, I mean, it's first, improving behavior health is not a partisan position. I mean, it's a value that we all should share. So, there should be bipartisan support for increased mental health funding, implementing access to drug treatment courts, and then, of course, and it'd be nice this year to really focus on PDMP and getting Missouri's first prescription monitoring program. So that's what I think we need to be focused on, and I believe that should be the concrete steps that we take steps forward towards.
Thank you. And Representative Coleman, will you take that question too?
Sure. So I'll just echo the words of Senator Williams that there's a large bipartisan consensus that we need to be investing as a state in our mental health and behavioral health infrastructure. In fact, in the State of the State address yesterday, the governor, today's Friday, on Wednesday, I'm sorry, I'm losing my days.
2 days ago.
Yeah, 2 days ago, the governor outlined his proposal to provide additional resources and start new behavioral health centers across the state so that not just those in our urban areas have access, but rurally as well. I think extending some of the emergency orders that have put in place via COVID to allow access is going to be incredibly important, whether that's extending the radius for nurse practitioners or broadening and continuing the efforts for telehealth medicine, that those restrictions, COVID did, and a pen stroke, what advocates have been looking for 20 years to do as far as broadening some of those practice areas, as well as broadening access via telehealth. And so continuing infrastructure investment for broadband so that those communities that don't have access are able to receive those is important as well.
Thank you.
I see
so
Representative
much.
Gunby is on as a guest. It looks like she should be a panelist for sure. I know that this is an important area for her as well. So I don't know, Dr. Miller, how we can loop her in, but I saw on my screen the question came up from her.
Yeah, no, all dialogue is welcome. This is a rich community that we have, and many vested interested. So. And I really like your point about distilling best practices from this crisis of a pandemic to figure out, like, what do we carry forth? What is a valuable practice? Thank you so much. So our next question, how do you ensure that you understand and respond to the vital needs of your community? And Representative Coleman, we're going to return to you for this question as well.
Sure. So a lot of that is just good governance questions. How do you make sure that when people are reaching out to the representative government, they have a real person answering the phone and following up? One of the best things about serving as an elected is that we really are, in many ways, able to cut through the red tape and through the bureaucracy to get our constituents answers when they have them, whether that's people calling and wondering why Jefferson County has received no COVID vaccine. I share that concern and certainly am advocating and working with the governor's office to make that happen, or whether it's questions that you're getting about, Department of Labor unemployment benefits. So really, I'm kind of floundering a little bit, but we are people's best advocate in the building, and we're able to get answers throughout state government in ways that often it can be hard to navigate on your own. So I would encourage any of you to look who is your representative and call them. I know almost all of my colleagues, we really do strive to make sure that every call is returned, every email is returned, and that we get follow-up questions, and our staffs are on hand to help with that as well.
Thank you. Thank you. And Representative Unsicker, will you take this question as well? How do you ensure you understand and respond to the vital needs of your community?
I would echo the words of Representative Coleman. It's a lot of good governance. It's a lot of listening to community members, reading the emails that come in, taking the phone calls that come in, and just trying to understand what people need. I work hard to stay in contact with community leaders and community members in my district. I also try to monitor pages on social media so that I can see what people are saying when they don't reach out to me, but I encourage people to reach out to me because that's the best way to get some help when you're floundering. I know a lot of people flounder and struggle when they try to access state government, and your state representative is really a good person to advocate for you.
Thank you. And you can keep your microphone on because the next question is going to go to back to you, Representative Unsicker. So the next question is the following. Missourians have suffered physically, mentally, and economically from the dual pandemic of COVID-19 and racism. How are you using your platform in developing policies to address racism in particular?
Well, I'm advocating for the equitable distribution of the vaccine and for equitable distribution of funds. We recently received housing funds from the federal government that we appropriated to help with rent and utility assistance. And I pushed the department director to ensure that these funds go first to the communities with the highest needs. This is the Emergency Rental Assistance Program, and we need to make sure that the information about that is getting out because that's hundreds of millions of dollars that's going toward rental and utility assistance that people need to apply for so that we can get that money out. I'm also working on maternal health. That's a priority of mine. I have a bill to require the Pregnancy Associated Maternal Mortality Review Board consider the role of race, ethnicity, language, and poverty and other social determinants of health when it makes its recommendations.
Thank you. Thank you so much. Senator Williams, can I ask you the same question? How are you using your platform in developing policies to address racism in particular?
Oh, that's a great question. When I was elected to the Missouri Senate, I was actually the first Black man to serve in that chamber in nearly 2 decades. So now I'm currently serving as the first Black man to serve in a leadership position in decades. So my job is to share my insights and my experiences with people who may not have grew up like me or don't represent or live in a community like mine. So I use this perspective to really shape public policy for the better. So whether it's legislation to require diversity training in law enforcement agencies, or talking about the importance of cultural competence among healthcare professionals, as you all know, when you just look at the maternal mortality rate, not only in the St. Louis region, but how it compares to the rest of the world, I mean, it's slightly unprecedented. So we should be really looking at not only from a healthcare professional perspective, but whether it's pertaining to law enforcement or whatever the case may be, that we're really keeping the struggles and conversation around racism front and center.
Thank you. Thank you. Our next question is as follows. Underlying disparities in racism have led to longstanding inequities in access to care. How can Missouri ensure effective resourcing and access to mental and physical health services for communities with historical barriers to access? And Representative Coleman, can I turn it over to you to take this one first?
Sure. So you're going to hear, I think, a lot about the maternal mortality rates and infant mortality rates in the state as we're answering these questions, because it has reached epidemic and truly crisis proportion. And it's something that has really horrified, I think, everybody in the state, along with our higher levels of violence in some of our communities as well. When you're seeing on a daily basis, as a mother, as a lawmaker, as just a person in the community, you can't look at those numbers and not see the faces and the names of the people who are affected. And so we are really looking very carefully at how, I will just say, budgets are moral documents, and we vote with our dollars about what is important to us. And you will see from my office in particular, an incredible push to make sure that we are investing in getting access to data Representative Unsicker spoke just a moment ago about wanting to expand what those metrics are that we're looking at when we're making our public policy decisions. And I know that this isn't a sexy answer and it's not the kind of headline grabbing answer, but the truth is what we don't measure, we don't really care about. And until we have access to good data about what's happening and where those access points are failing, it's very difficult to make policies to fix that. And so, like I said, my office, I'm working on trying to push over $1 million into the budget to get access to better extract the data from our systems. Right now, everything is really segmented. And if you look across the state, we have an incredibly rich amount of data, but we can't get to it to parse it and to measure it and to see, and our researchers can't do the same. And so what I'll be doing is working on trying to make sure that our systems can talk to each other, and then that access, that information, once it's pulled out, is able to go into our research institutions so that we can get public policy solutions that are working, not just in other states, but what can work here in our own state.
Thank you. And that echoes the emerging and contemporary practice to collect data and to disaggregate it by race and income as well. Senator Williams, will you take on this question too, please? Oh, unmute yourself. Thanks.
Sorry about that.
That's
So
good.
we often say that mental health doesn't discriminate, and this is true. Mental health conditions usually impact people regardless of their race, their ethnicity, their class, or their gender. So unfortunately, the same can't be said about mental health treatments. You know, Black communities face barriers that are accessing mental health services that result in less than access to care, which ultimately creates more cultural stigma and lower quality of care. So for example, depression rates for Black teens are 30% higher than any other race in their age group. You know, those are statistics that are real, and we have to really make sure that we are putting, as Representative Coleman stated earlier, our dollars where those issues lie. So, you know, I think that we really need to recognize that these disparities are really hitting certain communities in an unprecedented way. And we have to make sure that we really acknowledge that and make sure those resources are available.
Thank you. Thank you so much. Our next question brings us to the topic of Medicaid expansion. So Medicaid expansion, which was passed by the Missouri voters in August 2020 and supported by Governor Parson in his State of the State address 2 days ago, will be an important tool to address COVID and behavioral health needs. How will you ensure the optimal implementation of Medicaid expansion? And Representative Unsicker, will you start on this question, please?
Thank you. Yes, well, I serve on the Budget Committee, the House Budget Committee. I also serve on the Subcommittee on Appropriations for Health, Mental Health, and Social Services. And Medicaid expansion and Medicaid in general is just something that I have been watching carefully for several years. I'm watching the expansion roll out. So far, I've been pleased with how it's been proposed in the budget recommendations, and this proposed state plan amendment was made public this week, and I think I'm happy that it doesn't have restrictions on Medicaid implementation, and I hope that the expansion rolls out as well as it has shown this week it was. I know with the federally declared public health emergency, Medicaid has been extended to any individual that has been declared eligible at any time during the pandemic. If they're in, so once people are enrolled, the state keeps them enrolled until the public health emergency ends, which I'm told is going to be not before the end of 2021. So more people are enrolled in Medicaid than almost ever before right now. And we have Medicaid expansion happening at the beginning of July. So I'm pleased with what's happening with Medicaid right now.
Thank you. And Representative Coleman, will you also answer this question, please?
Sure. So, well, access to public health is incredibly important. We want people to be able to visit their doctor and to receive care. As Representative Unsicker said, we've never had more people enrolled in the public system in Missouri, and those numbers will continue to rise. And without looking at any verification, I just would like to caution this audience in particular that as we start to have verification again, you will see another drop in the rolls as people get taken off of the system. And that happens because when you say we're not going to, anybody at all who wants to be enrolled and we're not going to check that enrollment, then eventually when the systems start to catch up with that, there are drops in the rolls. So kind of got off on a little bit of a tangent there, but I was against Medicaid expansion, not because I don't want people to have access to quality care. Most Missourians do receive their health insurance through private health insurance providers, and those costs are continuing to escalate. Medicaid costs are also, just like the private market, escalating across the country, and states that expanded Medicaid years ago are looking at the same kinds of problems that Missouri is, which is how do we pay for it? We have to make sure that we're not cutting our kids' educations, that we're not doing those other things in order to pay for, healthy adults to have access to health insurance. And so I'm frankly, I'm really worried. I don't know how we're going to pay for it as a state. We had 2 tax payments this last year because of the delay in the federal tax payments in April, which means that our revenues are artificially high for this year. We have metrics in place that when you hit certain revenue numbers, that those tax rates drop at the state level. And so as we have next year, only 1 tax payday coming in, and we have less resources to pay for all of the very many things that state government has to pay for. I don't want children, I don't want those in our foster care system, I don't want our elderly, I don't want our disabled to not have access to the care that they really need. And states across the country are really grappling with how do you pay for the exponential growth and cost of medical services with declining tax revenues. And people in Missouri again and again have rejected paying more taxes, even on things like the gas tax 2 years ago. And so it creates, kind of a really difficult situation where the people of the state are saying, we do not want to pay more taxes and we want more government services. And then how do we provide that and pay for that? I'm incredibly proud that Missouri has met our constitutional requirement of passing a balanced budget, unlike some of our neighbors, Illinois in particular. And I don't know how we're going to continue to do that. So I kind of sounded the alarm before. I'm sounding the alarm still. I'm really nervous about this. We know that our kids are getting access to care through the public school system, through other channels, and I just don't want to take revenue from those sources either. So I don't share everyone's enthusiasm. I just am really worried.
Well, we appreciate that, and we need this dialogue. And certainly as a clinician, our favorite form of cost reduction is keeping our patients healthy and out of the emergency department and hospital, and somehow in our state working together, maybe we can figure that out. Thank you.
Well, I look forward to working more with you. You and I, you've been very generous with sharing your time and expertise, and my hope is that we can continue to work together to try to find a solution.
Likewise. Okay, we're going to move on to our next question. Senator Williams, you'll start with this question, if that's okay with you. Providing access to behavioral health care requires more than just increasing services. So how do you plan to decrease logistical barriers to behavioral health services, such as transportation and internet limitations, et cetera? Senator Williams?
Yeah, my primary focus would be, just as a member of the Senate Appropriations Committee, I'll be working on transportation and telehealth assistance for Missourians. I think we have House Bill 10, which is mental health. I think that's $720,000 for contracts with telehealth physicians. For fiscal year 21, I think House Bill 11 has social services, which is $46 million for non-emergency medical transportation for Medicaid recipients. Higher ed with Missouri Telehealth Network, I think that's $400,000 or so for fiscal year 21. And then we have another higher ed bill with Extension for Community Healthcare Outcomes program. So that's like video conference technology to allow experts to provide information to healthcare providers. So that'll be in the sum of 1.5 million. I think also funding for public transportation. As we all know, I had a conversation with Tavi Roach with Bi-State, and we had a conversation just core funding for transit assistance for larger metro areas. So St. Louis, which goes directly to their transportation authorities and does not come from the legislature. Additional programs is like non-for-profit transporters, elderly people with disabilities and low-income individuals. So that's in the sum of roughly $3 million, $31 million for locally matched grants to small urban and rural areas. And then 61 million for grants to non-urbanized areas. And then another million for grants to assist with private, non-private organizations providing public transportation services. As you know, we spent quite a bit of time looking through these numbers in the Senate Appropriations Committee, and I'm really committed to those issues. So it's so important, whether you agree with where that money should go, is knowing those numbers and know where that funding is going. So hopefully that wasn't too convoluted, just touching on some of the things around transportation. We really should be focused on telehealth assistance. That is going to be what I believe the new normal post-COVID. So really having the state in a position to really keep that at the center is something that's going to be really important. And that's where we'll be spending a lot of our time, me personally, in the appropriations process in the legislature.
Thank you so much. And your point on telehealth is so key. Not all telehealth is created equal. And as a telehealth provider myself at times, taking care of someone who has a perfect internet and a helpful grandson is dramatically different than someone whose sound and audio is coming in and out, or if whose video is unavailable. So that term telehealth assistance is a key and meaningful term. Thank you. Representative Unsicker, will you also take this same question? So as I noted, providing access is more than just increasing service. So how can you help to decrease logistical barriers?
Well, I don't have a lot to add over what Senator Williams said. He went through quite a bit of ways that we're decreasing logistical barriers. I think telehealth is so important, and we need to make sure that high-speed broadband is accessible in every area of the state, and we need to be creative with using our resources to ensure that. I was happy to see school districts in my area help students and families get high-speed broadband access who didn't have it. And I think that's a creative way that we use our funding to ensure that students can learn. And I think there are creative ways we can make sure that people have access to broadband to get healthcare as well.
Thank you. Thank you. So keep your microphones on. Our next question is a speed round. And we are going to go in order of Representative Coleman, Senator Williams, and then Representative Unsicker. Here's the question. 7 St. Louis-based public health organizations are sponsoring this event. We represent provider, patient, and community perspective. How can we collectively help educate you around health, particularly behavioral health issues? Representative Coleman.
Have your members call their representatives directly or email them directly. There's nothing that is more impactful than a constituent reaching out and saying why this is important. The other thing is understanding legislative time, which is like a brush fire where there's absolutely nothing to do until the wind shifts, and then it's really important to get access quickly. So having point persons that people know if there's a question about something that's going to hit the floor at 3 o'clock and it's 1 o'clock, how to get that answer from them. So designating an expert who is able to kind of be that point person and building those relationships, and then having constituents reach out.
Thank you. Senator Williams.
I think my advice is just don't assume that lawmakers are always aware of big problems. Don't assume that someone else has already told us what we should know or what we need to know. So we often get pieces of information from constituents, from state agencies, from various stakeholders in our respective regions, but rarely do people present us with the full picture. So if there's something that you think that we need to know, please alert our office, shoot us an email, give us a call so that we know what's happening around these issues. Because in the legislature, and I tell a lot of folks this, especially in this space, you all are experts around this issue, and we are experts around a little bit around everything. So getting that full picture is always so helpful and beneficial.
Thank you. I'm kind of hanging on to those two words, don't assume. Because in your understanding, you're getting to know your community's needs, to not assume. We teach our medical students the same thing. Don't assume you know everything about your patient. Keep an open mind, be ready to learn at every moment. I really like that phrase very much. Representative Unsicker.
I think it's so important that you let us know what's going on from constituents, and also the organizations can email us, and I'm happy to set up Zoom calls to discuss things more in depth as my schedule allows. But emails are very helpful in letting us know and providing information as our phone calls.
Thank you so much. And I think it's safe to speak for these 7 dedicated organizations that their door is open to you. If you have questions about policies, or if you want to further put your finger on the pulse of issues affecting the community, that we would all like to continue that dialogue. Okay, next question. Economic insecurity has been a major driver of stress during the pandemic. What policies do you support to prevent evictions, utilities shut off, and other financial stress during and after the pandemic? Now, some of you have spoken to this already a little bit. However, if you can address this next, Representative Coleman, please.
So I really support that we need to have policies to safely reopen. I think that we're seeing the negative impacts happen for childcare in particular. We have, there was a study that just came out, and I'm so sorry, I can try to find it and shoot it to you, Dr. Miller, to share with everybody, that talked about the unemployment rate and how it has almost entirely been affected by women who have been forced out of the labor force because there is no safe option for where their children can go. They're either too old or there are unavailable childcare facilities. The schools are closed. And so women are dropping out at unprecedented levels when they're the head of the household. That's obviously disaster for the entire community. I think people would rather be able to earn a living for themselves and that dignity of being able to work. We have a really, frankly, I think, bizarre policies right now that are hodgepodge across the region, with Jefferson County, St. Charles, St. Louis County, and St. Louis City all treating the pandemic in vastly different ways, when as a region we're addressing the same concerns. And the result of that has meant that whether you're able to continue to work and provide a living has largely to do with where you happen to be renting or owning your home at the time that the pandemic hit. And I think that just like anything else, your access to be able to earn a living shouldn't depend on your zip code. So I am supporting broad policies to be able to get people back into school and back into work.
Thank you for highlighting those really important issues. Senator Williams, your turn.
Yeah, well, the state of Missouri is actually set to receive nearly $408 million for rent and utility assistance. That's in addition to the tens of millions that St. Louis County and Jackson County will receive directly. So this money will go through the Missouri Housing Development Commission. So applications for assistance, I believe, opens up on February 1. So we need to make sure that people who need help get help, and make sure that the organizations you work with are aware of these services. So if you run into people with problems, they can let us know right away.
Thank you. Thank you. All right, hot topic, the COVID vaccine. The COVID vaccine offers a sense of hope to many in our community. How will you help Missouri make the COVID vaccine available to our most at risk and underserved populations? Representative Unsicker, will you take this one first, please?
Well, as far as making the COVID vaccine available, we need to make sure that people are aware of it, aware of how to sign up. We need to expand access to signups so that people who aren't computer savvy can also sign up, maybe through the phone, to receive the vaccine or to get in line for the vaccine. I'm also very concerned that about the excess vaccines that some pharmacies are getting. I know there's a pullback from the state so that they can go to mass vaccination sites. And I'm glad that North St. Louis County is going to receive a mass vaccination site, I believe. And that will be the only one for now in St. Louis County. So I'm glad that that will go to and hopeful that that will go to a more underserved population. But we need to make sure the rollout is smooth and effective. And I think it's been pretty choppy so far. And we need to be finding out why that's been.
Thank you. And you remind me that some of my most vulnerable patients are the least able to sign up for registries on the internet. Thank you so much for your bringing that issue up and your sensitivity to that. Senator Williams.
Yeah, there's several concerns about it on multiple levels. I am concerned with the reports coming at the federal level from President Biden and his team. They said they received no real vaccine distribution plan from the previous administration. So I was hoping that there would be a sufficient handing off of the baton. Instead, they seem to have to start from scratch. But the good news is it seems that the new administration is taking that more seriously. In terms of just here locally, there are going to be mass distribution sites, but the question is there going to be a sufficient number of vaccine available to, one, open, and two, be able to cover a sufficient population of people? Dr. Miller, you understand firsthand as someone who serves in a community where folks go to FQHCs and you see patients that feel very comfortable going to those facilities. Myself as a board director for one, to think that these facilities have applied for, and went through the proper channels to be a vaccination location or site, but they still haven't received any vaccines. So we're working through that, and I'm confident my colleagues are doing the same, and we all have the same concerns and you know, I'm trying to be positive about it because it's really a concerning situation right now. As we've seen that there's been other parts of the state where there's been an overage of vaccines where they've had to dispose them. We've heard situations as severe as Poplar Bluff having 500 additional vaccines where they just started calling people to see if they wanted to get the vaccine, whether they were eligible to receive it in that tier or not. And I'm confident a lot of those vaccines were disposed. So to think that we have such a large number of folks in the St. Louis region, in Kansas City, throughout the state, that have not received the vaccine. My grandfather, who's 91, has not received the vaccine. Folks I know that are educators and teachers have not received the vaccine. And to even think in the legislature, regardless of what people may think, you have roughly 200 legislators before you even start counting staff members that are either getting exposed to COVID-19 or potentially testing positive, and they have not received the vaccine either. So we got a lot of work to do. I will remain optimistic. It's very difficult to squeeze the hope out of me, but we do need to get that process under control.
Thank you for your comment on that. And indeed, some of our health center staff have only just started to become vaccinated this week, and yet this dedicated staff has been in the face of patients doing COVID testing for months and months and months. Thank you, and thank you for your equity lens to this as well. Okay, so I have two more questions that we have prepared, and then we're going to open it up to our audience. So this next question, what are your long-term plans to promote behavioral health after the COVID-19 pandemic? So after the pandemic. Representative Coleman, will you start with this one, please?
One of the things that we're not well set up for as a legislature is long-term plans. I think it's a really frustrating thing that's a result of term limits. We think about budgetary items in a term of how does it impact this budget rather than, if we invest it more today, it will decrease the cost over the long term. We're not well set to capture that. So, I will say that I am guilty of thinking and the here and now as well when we start looking at what policies that we should take place. And as far as COVID goes, everyone's hair has been on fire, so to speak, since last February. There are some things that have come out of COVID, though, that I do hope that will continue. Certainly access to behavioral health through telemedicine we talked about earlier, but even unintended consequences like the way that the courts are operating that I'd like to see continue. In our child abuse and neglect cases, by having all of those status hearings via Zoom, we're having higher participation from parents who otherwise might be afraid to come into the courthouse because they have outstanding warrants or there's liens against their property or they have garnishments that they're trying to keep at bay. And so they're able to make a better decision and be able to be a part of that team providing for the care of their children while they're working towards reunification. So that has been one of the things that I would like to see continue, is looking at what has been a positive effect. The other thing too is we're looking at education reform. You have districts that are neighboring right next to each other who have had vastly different responses to COVID-19, and it shined a light on how the Windsor School District might be a better fit for my child to be able to receive services through the Gifted and Talented program, and the Fox might be the better system for my child to receive for her individual service plan for her special needs, and recognizing that everybody doing everything and is probably not the best way to fund access to those. So I think again, we're not well suited to the long term, but this has shined a light on how some of these policies that people have been working on for years are maybe going to be able to leapfrog where they would have otherwise.
Thank you. Very interesting on the status hearings too. Representative Unsicker, will you take this question as well?
Yeah, first of all, I plan to keep fighting for healthcare access through Medicaid policy. I support healthcare access for all Missourians. And as far as education, I have filed House Bill 776, which extends the Trauma-Informed Schools program to 5 schools in St. Louis City to make them trauma-informed schools. And I'm hoping that will get some traction this year. We need to use trauma-informed policies. We need to keep that in mind when we're legislating as well. So, yeah.
Thank you. Thank you. At this point, our last formal question is a speed round. And then we're going to turn it over to our audience questions. So which of our concerns can you act on most quickly? I'm going to start with Senator Williams, please.
Call me Brian. I've been called that for all my life, so it's completely fine. I would say probably one of the, most important concerns that I'm going to focus on and that we should act on most quickly is probably make sure CARES Act funding is getting out to the communities where we can put them to work as quickly as possible.
Thank you. And Representative Unsicker.
I would second that. We need to make sure the CARES Act money is getting out, and we also need to make sure people are aware of it and utilizing those funds. For example, the Emergency Housing Assistance Grant. We need to make sure people know about that chance to apply for rental assistance and do that because people are going to be evicted. We also need a moratorium on evictions so that people can stay in their housing.
Thank you. And Representative Coleman.
I think vaccine distribution is the thing that we're going to be able to act on most quickly. We went from 3 months ago, people mocking then President Trump that we'd have a vaccine at the end of the year to frustration that we're not at 1 million doses a day in every state. And I continue to be impressed by the the scientific community's ability to pivot and to gear up research and our ability to waive the red tape and get through trials and certification and distribution. And so Senator Williams said earlier, it's hard to squeeze the hope out of him. I understand that this isn't as fast or as consistent as we would like, and that communication isn't in any way where everybody would love it to be. But I don't know if anybody has seen the rates nationally on COVID diagnosis in the last week. We've seen declines like we haven't seen ever. The rates are falling. The power of the vaccination is working, and at such low levels. So when we're talking widely between 4.5% to 6% of the population's being vaccinated, and seeing the drop that has had when we're looking at our most vulnerable patients, I feel really hopeful about where our hospitalization rates and our death rates are going to be in the next 3 to 4 weeks, because we're getting the vaccine into the most vulnerable who have the worst outcomes. So we'll have COVID around still, but hopefully it's not going to be causing the kind of death and destruction that we have seen it up till now.
Thank you. Thank you for that. So everyone take a good stretch, a deep breath. We are now going to invite our panelists to address the following questions from our audience. And this is a free-for-all. So I encourage you to just jump in and answer as you see fit. And we can have 1, 2, or 3 people answer. We do appreciate everything that you've contributed already. And it's important for this to be dynamic and interactive. So thank you. So the first question from our audience is, please speak to Senate Bills 12 and 20, which could remove power from local health boards, thereby intervening in health decisions at the local level.
Sorry, I was trying to read the chat that was directed at me, and it's hard to listen at the same time. So I'm going to punt on this one.
And we can filter through the chat, and
Okay.
we're working as a team here, so you don't have to juggle everything. Representative Unsicker or Senator Williams, I'm still going to call you Senator Brian Williams in honor of your position. Do either of you want to speak to this?
Well, I'm very concerned about limiting the power of local health agencies. Governor Parson has given a lot of leeway to local health agencies, and there haven't been a lot of statewide guidance or regulations made about COVID. So I think having the local health agencies able to do their job is really important.
Yeah, I echo Representative Unsicker. So, with these bills, I am familiar with those bills. I'm going to kind of talk a little inside baseball, which I'm sure my colleagues can appreciate. We find great solace in the fact that the Senate moves very slow. So you have some of these bills that come up, and we're fortunate to have mechanisms, rules, and procedures in place to strategically debate these type of issues. And I'm confident in the Senate we'll have to talk an issue like that through. Local control is convenient until it's inconvenient. So it's just what it is. And once that bill gets to the body, I will continue to dissect and investigate it like I do every piece of legislation that comes through the body, and we'll assess it there. But my general thoughts about it is that we have health departments and leaders in local capacities for a reason, and we should be trusting them to do their jobs. And if it gets
so I'm sorry, Dr. Miller, I thought I was going to punt, but I'm going to jump in here because now I'm oriented to the question.
No. She punted. It's over.
No. I'll be in your office otherwise. It's better to listen now, right?
but we have to look at that bill. But I do have faith in local government, to local leaders and experts to do what they need to do around these issues. But I'll assess the bill and accordingly once it gets to the body. If it gets supporting local control does not mean supporting one unelected health official making all of the decisions. Anybody who is in St. Louis region has seen the dysfunction that's happening at St. Louis County Council and the St. Louis County Executive. And Emily Doucette, who is the acting health director for St. Louis County, has issued over 200 pages of guidelines
unilaterally and has made an argument that she is empowered to do so by state regulations against the county charter. And I don't think that providing guidance to say who locally has the authority to do that is a bad thing. I don't think that anyone questions that St. Louis County has the ability to issue health orders that are appropriate to St. Louis County, but that should be residing within the St. Louis County Council and not one unelected bureaucrat making single person rule against all of the protections therein. So there's my counterpoint to those bills. I don't know whether those solutions are perfect, but we need to make sure that things are acting according. And when you have people not following their own charter, that's not saying you don't support local control. It's saying I don't support one person making all of the rules. And I ran off Senator Williams, so now I feel really bad. Brian, come back.
Well, I appreciate you raising the complexity of this issue, and certainly public health initiatives involve like complex team-based decisions. This has been a hard time for all. Senator Williams, did you want to respond?
No, and keep in mind, I have not read through every page of this bill, and fortunately, we have the luxury that the representatives don't, and that's to slow things down and be able to really have a deliberate discussion around bills. So I have not read through that entire bill, and as you know, we have several hundreds and thousands of bills that are filed in the legislature, and we have to try to work through those. So that's what we'll do.
At this point, I'm going to turn it over. We got a number of questions about Medicaid expansion. And so the first question is, how will Medicaid expansion help Missourians with COVID? And Senator Williams, can I turn this back over to you because you didn't get a chance to address this earlier during the formal program. So how will Medicaid expansion help Missourians with COVID?
So one, I did get to address it earlier. This is just my fundamental belief. As legislators, we've taken an oath, and that oath is to uphold the Constitution. And voters voted to expand Medicaid, so we have a responsibility to do everything we can to fully fund it and make sure that there are no levels of red tape and it's not really caught up in any type of I guess a loophole or something of that nature, and there's no crazy requirements put in place, work requirements, things like that. So if we do that, just really focus on making sure there's no red tape, making sure we uphold our oath as elected officials and honor the Constitution, which this was a constitutionally amendment that was initiative or that was supported by voters on the ballot, and that's what we need to do. So that's kind of how I feel about it, and I hope that my colleagues in the legislature do the same.
Thank you. Next question: what is the what is the legislature's plan to include Missourians' voice on the floor and to make live debates accessible to the public? How can our voices be included in the upcoming legislative session?
So I want to give a shout out to the House Technology staff who has made some incredible improvements on our side of the building and the House side. We have now, if you go to any hearing, there's a link where you can fill out remotely a witness form as well as submit testimony. I'm sure Representative Unsicker will concur that I know every committee, I read everything that comes in. It means a lot. And sometimes what written testimony is actually more powerful than a Me Too type of on the record quick statement in the building. So all of the cameras, we upgraded our cameras so you can watch the live debate. You can listen to the live debate. Every committee meeting is broadcast. As a chair of the Children and Families Committee, if people will send text messages to say, hey, there's a problem with the audio, those committee meetings stop until the IT guys have been able to get in and improve there. So I want to say that from when I entered the building just 2 years ago in 2018 to where we are now, there's been significant investment made. Our rules have also changed to allow remote testimony on a case-by-case basis. So you can write to the chairman and ask for that to happen if you do want to call in via Zoom or on camera.
Thank you. Does anyone else want to answer that question? I got many more, but jump in if you do.
The Senate's not quite so advanced, so that's probably why Senator Williams is quiet.
Next question. So we have witnessed an increase in drug overdose deaths during COVID. What are your plans to address this ongoing crisis more broadly?
I'll start. One, we just have to make sure that we're addressing the issue, we're providing resources, we're working in collaboration with organizations on the ground that are tackling issues around drug abuse and so on. And it's going to be really important that we really focus on wraparound services. I noticed that we tend to address one disparity, but we don't realize that it creates a kind of a domino effect. And just thinking about the social determinants of health and things like that really lead to drug abuse. These are things that could have started from the day that someone was born up until adulthood. So really having those wraparound services and being able to kind of be able to really diagnose folks that really tackle some of the things that they may have been, the trauma that they may have been dealing with for roughly their entire lives, and then figuring out how to support them to become ultimately independent.
Thank you. I'll pause for a moment if there's any other responses. All right, next question. According to the CDC, when people use syringe service programs, they are more likely to enter treatment for substance use disorder. How are you working to ensure syringe access legislation gets passed this year?
So the biggest thing that's going to help that is probably something that it has nothing to do with any of the panelists here. And that's that one of the women who's been pushing for that just got elected from serving in the House into the Senate. Senator Holly Rader has been an incredible advocate for those who are battling substance abuse problems, working very diligently for the last 8 years to try to get PDMP passed. I feel hopeful that that will happen this year. She's been working on destigmatizing some diagnoses, particularly around AIDS and HIV, as well as syringe disposal and MAT services. So I think that the likelihood of that being able to pass has nothing to do with what the three of us are doing and everything to do with what now Senator Rader is going to be able to do now that she's moved from the House to the Senate. Senator Williams is too humble to say this, but the amount of influence a single senator has, no matter what party they serve in or the region of the state, is significantly outsized to the role of a single representative. And having her strong voice there is going to really move that forward in the state more than anything else.
Thank you. Next question. How are we going to be supporting families of immigrants and refugees? St. Louis County has the largest international population in the state. This group is also working our essential jobs, but have been neglected from aid policy and language appropriate vaccine information.
That's a very interesting point, especially with the language appropriate information. I think we need to be making sure that information is distributed not just in English, but in a variety of languages so that people have the access to that. We also need to make sure that people aren't discriminated against because of their immigration status.
Thank you.
Yeah, and I'll add that it's just important to really continue to support organizations that are doing really good work around it. I've been proud to partner with organizations like the International Institute of St. Louis, who's done tremendous work. I think about immigrant home learning programs that really do a lot of work to ensure that not only immigrants, but women have access to quality services in the Bevo Mill area. So really just finding groups in the region and the state that really are providing not only access, but frontline services to ensure that immigrants have access to services that we all need to survive.
Yeah, I just want to echo that. Often we want to reinvent the wheel, but Missouri has a long history of public-private partnerships and reaching out to those groups that are already trusted members in their communities. And I think continuing that pattern is probably the best thing that we can do.
Thank you. Thank you to all of you. Okay, so this question just came in. We know COVID has disproportionately impacted Black and Latinx communities, as well as communities living in poverty. How do we ensure our recovery from the pandemic addresses this disproportionate impact? And what role does mental health play in these recovery strategies?
We're all trying to be polite, I think, in that going first.
I think
well, I think it goes back to my point earlier. You know, it's important to have these conversations because we're learning just as much as well with just issues and talking with experts and people that really spend such a significant amount of time doing this work. And I repeat, you know, elected officials, it's our job to know a little bit about everything, but you all know a lot about everything. So, you know, just really having this conversation and listening and learning is just as equally as important as answering the questions. So I think that's a really convoluted one. I think there's so many things that we can do, but I think the keystone comes back to just the state providing resources and again, having strategic public-private partnerships to make sure that we're providing the resources to organizations on the ground that see these disparities firsthand every day.
I think the other thing too is that as we're looking at as a state how we're implementing what our tiered system is, making sure that those communities that are disproportionately hit receive the vaccine first, even if we're scared or would want to have it ourselves. You know, the data widely suggests that before essential workers, even over 65 is the best place to be putting our vaccine. That doesn't feel good. I'd rather give that to first responders. I'd rather give that to the legislative staff. But the data doesn't point us to that policy decision. The data supports giving it to people who are living in long-term care facilities first, giving it to the elderly first. So I think continuing to make sure that we're using data-driven decisions and not politically expedient ones.
Yeah,
thank you.
And also, I think messaging is so important, making sure that people have the information they need to apply for a vaccine or to get in line for the vaccine, and the resources they need to get in that line, making sure people know when it's their turn, where to go and have the transportation to get there. Just all this infrastructure need and messaging need to make sure people know and can do what needs to be done to reduce the spread of COVID-19.
Yeah, one thing that we're going to do also, and if there's any groups that are listening or want to connect, and I'll make sure that I put my information in the chat. In addition to serving as Assistant Minority Floor Leader in the Senate, I serve as the chair of our newly established Black Caucus in the Senate. And we've been really looking at how do we focus on messaging, whether it's in the form of PSAs or beyond, and coordinating with different groups to really encourage various communities, especially the Black community, to not only trust the vaccine, but actually go and get it and know exactly where they need to go to get access to it. And so any ideas or anyone that's working in that space, I know Serena and Rebecca talked about it earlier, what they're doing with the task force. So it just needs to make sure that we're just creating more strategic partnerships where you have trusted voices that folks look to reassure them that this is the right thing to do.
Thank you. Thank you. Our next question that came in, it touches on some of what we've discussed so far, but it goes on to additional detail. What are you doing to ensure that mental health services are covered financially for the 124,000 uninsured Missourians who have mental illness?
I think I'm going to repeat what Senator Williams said earlier. It's so important that you're asking these questions because I've been quiet because I haven't been really aware of that issue of the 124,000 uninsured Missourians with mental health care needs. And that's something I'm going to look into. I don't have an answer for you as to what I can do about that at this point, though.
Thank you. At this point, I would like to give each of our panelists a minute to share some closing thoughts with us. I want to save time. After you do this, we're going to turn it over to the CEO of the St. Louis Regional Health Commission. I want to make sure that we save time for her. Would you please share some closing thoughts? If it's okay, can I start with you, Representative Unsicker?
Sure. First of all, thank you so much for having me on today. I have learned so much just from the questions you've asked, and they've been very insightful, and I want to thank everybody for participating. Please contact me and be in touch with any issues that you see that I can look into, like the one that was just asked about the mental health coverage for uninsured Missourians. There's so much, we are asked to be experts on so many different topics that there's no way we can be an expert on everything we need to. So please be in touch, and thank you for having me.
Thank you. And Representative Coleman, will you go next, please?
Sure. So I love doing these panels, and I appreciate very much the opportunity to participate. I'm often the only Republican on the panel, and I'd like to say that one of the things that brings me a lot of hope for our state and for our country, and I hope brings hope for you as well, is that although we often disagree on the best public policy path forward to be able to reach the goal, a lot of our goal, and those are important. I'm not in any way trying to diminish the importance of those disagreements, but we do share by and large the same values. And, I didn't answer the last question in part because sometimes I don't think that people are going to like the answers that I give, which is my belief is that the best way we can help people is by having policies in the state that have higher employment and prosperity for the larger community, because that's the best way for people to be able to have access to these through the private markets. That doesn't mean I don't want everybody to have access to healthcare. I think it's incredibly valuable, and it hurts us as a society when we don't have that access. But we have disagreements about how we can get there. And so these types of discussions are really important to be able to hear voices, kind of across the spectrum of saying, we want our population to be healthy. We want to have strong families. We want to have people living to their full capacity and be able to meaningfully contribute. And how we get there, we differ on those ideals, but we don't disagree on the values of people being well. And so thank you so much for the work that you all do in providing services to our community. And thank you for having me today. I appreciate it.
Thank you. And Senator Williams, any final thoughts?
Yeah, one, I want to thank you all again for having me here to discuss these issues. It's really good to just see the collaboration between the St. Louis Regional Health Commission, as well as the 6 other sponsoring partners that really just brought so many great people together with very good questions that really address some serious concerns that's facing our state, as well as our country. I want to also just remind folks that I know sometimes our country and our community seem deeply divided, especially after a major election. So I firmly share what Representative Coleman said, that I believe there's more that unites us than divide us. And as a state senator, I proudly not only represent my district, but everyone in the state of Missouri, and not just the ones who voted for me. And I hope that other leaders feel the same way, because mental health disparity, addressing children's behavioral health, women's maternal health, seeing how do our country move forward after a global pandemic, and then also building a community that's free of discrimination should not be partisan positions. They should be common goals that we all share. So I'm grateful for the opportunity to be a part of the conversation. I will put my information in the chat. Please feel free to reach out if you have any questions, if there's anything that any of us can do to be of assistance, and please feel free to keep me in a loop for further conversation. Thank you so much for having me.
Thank you. So a special note to the three of you. You have gone above and beyond to help us today. And I really cherish an authentic dialogue with what Representative Coleman referred to as voices across the spectrum. And I appreciate your collaboration for us to build a better Missouri. I also really want to express my personal gratitude to the 7 organizations that hosted this event, and to Serena Mohammed and Rebecca Bennett for your comments and contribution at the beginning of this and your ongoing leadership in our community. With that, I am eager to turn it over to Angela Brown, the CEO of the St. Louis Regional Health Commission. Angela, you can take it away. Thank you.
Well, good afternoon, everyone. I'm Angela Brown, the CEO of the St. Louis Regional Health Commission, and I just want to say thank you to all of our impressive panelists, as well as our wonderful moderator and our partner organizations who helped make this event possible. And to the audience that attended, thank you for joining us for this critical conversation during the pandemic during this time. Without you all, this event would not have been a success. So thank you for joining our first town hall, and we look forward to many more, and definitely our continued work with Representative Unsicker, Coleman, and Senator Williams. So we have some action items for you today. To get involved and to learn more about the work the RHC is doing around policy, please go out to our website, www.stlrhc.org. We are starting an action alert newsletter. So please sign up so you can stay informed about different advocacy opportunities. On our website, you will also find a policy tracker to stay informed about the bills that will impact the health of Missourians. And as Senator Williams mentioned, there are tons of bills that are entered, and so definitely is a quick way to stay up and on the top policies that we're tracking through the Regional Health Commission. Please visit our website to learn more about those. We also encourage you to vote. And on our website, we have a page for safe voting during this time, particularly about some upcoming elections. So make sure you are registered and have a plan for how to say vote, and there is more information there on our website. For the St. Louis City residents, we have an upcoming mayor debate that will be on February the 10th with the Community Builders Network. We are a sponsoring partner of that event, so if you are available, please go to our website and sign up and find out more information about that. Following this event, we will have a follow-up email to tell you about all the wonderful opportunities I mentioned, as well as answer some of the requests for information that was provided in our chat. Will definitely be out in our follow-up email to you. So before I close, just want to say we know behavioral health, health and wellness is very important for our region. So if you know of someone who's in need of services, who isn't feeling like themselves or do have particular needs related to that, feel free to reach out to one of our great partners, United Way 211, where there's someone to help connect you to services. So thank you again for your participation and for your dedication to improving the health and well-being of our community. Please stay well and have a great weekend. Thank you.